Think we're being live streamed. Hello, hello. I think we are. My friends. All right, let me just pull up my iPad here and make sure I can see us on the book of face. Happy Thursday, my friends. I am so excited, as I always am on Thursdays, to be here with you. And as usual, here's what can tell you is I recognize that I just love to challenge myself here with sometimes with these lives that we're doing on Thursdays. Now, I do apologize. I did not get the info out on this one. And that's okay. Sometimes I just don't get to that. This week started off a little crazy. And honestly, I hadn't fully decided what we were going to talk about. And then I decided that this made the most sense. Well, Jackie wanted it. Yay, Jackie. And I really think that I had a couple conversations, and I think there's a lot of confusion around this, like there is around many things in menopause. So what I am going to share with you today is what I found from reputable sources, what I have found for myself as someone who is never eligible to take HRT, what I am finding for my clients who are not taking HRT and who are taking HRT. I don't not work with women who take HRT. And I do not want to sway your decision in any way. I want to make sure that you know all of your options, because all I want for you always with anything around your health, your life, is I want you to make informed, rational decisions. And I want you to like your reasons for doing it. Okay. I say that to all my clients when we get on the phone, if they're like deciding if they're going to work with me or not. All I want them to do by the end of the discussion is come to a decision, make a decision, and like the reasons for it. Because a lot of times we choose just to make no decisions, and then we're really not taking charge. And if there has ever been, ladies, a time in your life where you really want to be taking charge and being your own advocate for what you want, now is your time. And I feel obviously very passionately about this because we have a disservice, I think, in our country with our medical industry. You know, a lot of the doctors you talk to are not going to give you all the options. And that is what really, I think, frustrates me still. I didn't get it 10 years ago, and people still aren't getting it now, right? You're basically being given one option. Here you go, take hormone replacement therapy. And again, I have no judgment for anybody who chooses to do that. I just want you to know all of your options, right? Medication, just like now, the whole thing with throwing all these medications for weight loss at somebody, you know, right off the bat, without talking lifestyle, without talking food, without talking anything. I mean, it's just mind-boggling, you guys. So do me a favor, let me know. Hello, Sydney. Let me know you're here. So again, when I do my research, I stayed away from everything in the UK just because I want to just stick with what we've got going on here. And you know, go with Cleveland Clinic, Mayo Clinic, Cedars-Sinai, right? Like trying to only go to the more reputable sources for information, because, you know, we can go down a rabbit hole. But before I do dive into what I have prepared for you, let me just find it here. I do want to say that, all right, I am looking at, where did I find this? Cleveland Clinic. And I just want to say, when we're talking about HRT, from what I am finding, again, because bioidentical wasn't around back in my day. But here is what I want to tell you. Okay. Where did it go? Basically what I seem to find is that compounded bioidentical hormones are advertised as being a safer, more effective, natural, and individualized alternative to conventional hormone therapy. However, this is from Cleveland Clinic. These claims remain unsupported. Also, the lack of FDA oversight for compounded hormones generates additional risks regarding the purity and safety of compounded bioidentical hormones. Although custom hormone combinations often include blends of the same ingredients found in FDA-approved bioidentical hormones, some also include additional hormones. These additional hormones have not had adequate testing and are not included in any FDA-approved products. So based on what I have read, when we are talking about what I'm going to talk about today, I think you could insert either one, because there is not any real definitive answers I can find, on this so-called more safer, healthier option. So, and again, I'm not here to judge bioidentical versus HRT. If you're on it, you're not on it, wherever you are at. This is just, and again, I'm not trying to go against anything your doctor might have told you, but and maybe you have a great doctor who is aware of what can be done for you naturally, and maybe not. I don't know. It's not their fault per se. They are not taught about how to handle things naturally, right? They are taught about how to prescribe medication. Okay. So what is hormone replacement therapy, right? What we are doing is replenishing the hormone supply to reduce your menopausal symptoms, right? That is the main reason people go on HRT. They don't want hot flashes. They don't want night sweats. They don't want brain fog. They don't want, why can't I think of anything else? The sleep problems, right? Okay. So HRT involves taking estrogen, and for most women, if you still have your uterus, another hormone called progesterone. Estrogen can be taken as pills, skin patches, or gels. If you're prescribed progesterone, it may be combined with estrogen in a pill or a patch, but will most likely be given separately to prevent breakthrough bleeding. Okay, so it can be beneficial for some women. There are also potential benefits to not taking HRT before or after menopause. So should you ever you should always make this decision with your doctor, of course. Okay. All I want to do is shed some light on some things that they might not be aware of. And if it does nothing else for you, ladies, but if it, hey, Andy, on the patch, if it does have you maybe looking more into it, then good for you. All I want is you to know all your options. Okay. So let's talk first of some of the potential benefits of not taking HRT. So you get to, when you don't take it, you get to avoid all the potential side effects, right? So there are a number of ones. Some people will get them. Some people won't get any. Some will get lots of them, whatever. But breast tenderness, bloating, headaches, mood changes can all be as a result of HRT, as can be weight gain. And one of the things I did find straight off the bat is HRT is not necessarily been shown to help with weight loss. I could not find any study to back that up. And from personal information, not from myself, but from clients, I've not had one say I went on HRT and I lost weight. Just like even when I was on levothyroxine for my thyroid, the weight that I put on because my thyroid had been underactive, it didn't make me lose that weight. I didn't gain more, but didn't make me lose anymore. Okay. So that is a potential benefit to not taking it. Now, Number two, of course, personal preference, right? Some women prefer to not take medication or add hormones into their body and want to do alternative approach, right? That is absolutely something everybody gets to choose, right? And for those people, and this is number three, is you want to go through this natural process of aging. For some women, accepting and experiencing menopause as a natural phase of life without interventions can be empowering and a way to embrace this transition. And let me tell you, I did not find it empowering at first because I didn't have a choice. I mean, I had already been booted off birth control probably 10 years prior when they started realizing the link between like blood clotting and strokes and birth control. And I was a heavy smoker. I was for years and years. So I'm not saying it's all rainbows and daisies. Especially it wasn't when I was figuring it out. Now it's much better. But it wasn't rainbows and daisies and unicorns. I'll be very honest. But I didn't have the option. And here's one of the things that in some of the women that I have worked with, and I didn't have this in here as a benefit, but there are, and I am one of them, when we talk about this natural process of aging, that, hello, Shelley, that feel that the severity of our symptoms for a lot of us is an indicator of communication from our body. It's an indicator that something needs to be addressed, right? So if your hot flashes are through the roof, it's a sign that your hormones are imbalanced, right? And yes, we can take hormones, or we can kind of see what we can do to get those hormones balanced ourselves, right? Because upping your hormones of estrogen or estrogen and progesterone, if you have not addressed, maybe the reason that the root cause of your hormones is your high cortisol levels, that's not necessarily going to change that. Excuse me. So if you continue to have this hormonal imbalance, you're still going to have symptoms. Does that make sense? Now, some of them will be lessened, some very specific ones like hot flashes and night sweats. But I think my feeling, and this is my personal opinion, you don't have to share it with me, is that it's like a lot of other medications. It masks what's going on in your body. And then are there going to be potential repercussions for that down the road? This is how my brain operates. Yours doesn't have to operate that way, but I just want to throw it out there. Then, okay, so in number 4, another potential benefit to not taking HRT is you get to work on individual system management. Non-hormonal treatments and lifestyle modifications can effectively manage and alleviate almost every menopause symptom for many women without the need for HRT. Does it take a little bit of trial and error? Absolutely. But does HRT take trial and error? Absolutely, because they're going to start you on the low dose, see how you do, and then constantly increase and go in that route. But the things that would be required of you for trial and error to balance your hormones, to treat these symptoms without HRT, are the things that are going to get you longer longevity in life. They're going to help you become a healthier person, so that when 10 years down the road, 20 years down the road, you have all that working for you, right? One of the reasons that menopause symptoms have gotten worse, I mean, there's a few different, right? We're being much more vocal about it, right? No question about it, right? So social media has created a whole different platform now to be able to talk about menopause. And there are people that have really set the stage, Maria Shriver and Oprah Winfrey and what's her name? I like her, Drew Barrymore and all that. And I think it's awesome. So we do know more about it. So were the symptoms as bad before? Maybe not. Maybe. But here's the thing. We did not have the food system we have now in place that is making a mess of people's guts, which is making symptoms worse, making the hormonal imbalance even worse. We didn't have the same levels of stress that we consider to be normal now that we did 50 years ago, 100 years ago. You know, we have probably the most unhealthiest population as a whole right now. And there is no question in my mind and in many people's minds that there is a correlation between all of this, right? Does that make sense, you guys? Is anybody with me on that? I see that Shelly's here. Andy. No, Andy, I'm not. I was never a candidate for it. I mean, I'm 11, 12 years post-menopause at this point. And I'm not a smoker anymore, but I was a heavy smoker back then. So I was offered antidepressants and said, see you later, bye. Not even once hello, Kelly, did they ask me about my life or what my habits, anything. It was just like, I talked about mood swings and insomnia, and I got offered antidepressants, which I never took because I just didn't want it. But anyway. Okay, another benefit. I swore to myself I was going to be quicker today because I know I go super long in these, but these are just such big topics. It's so hard. Okay, so another benefit is management of pre-existing health conditions. If you have certain medical conditions, history of certain diseases, not taking HRT might be considered the safest option because hormone therapies can potentially interact or worsen these, right? Number 6, emotional well-being. Some women may prioritize emotional stability and well-being without hormonal interventions and want to find ways to cope through emotional support, therapy, mindfulness practices, a lot of the same things I talk to you guys a lot. Again, very important that this is your decision. No, but just going into it that you might have to change your expectation of what your doctor might know. And you might have to do more advocating for yourself. Right? They might just immediately offer you HRT. They might not give you the option of HRT, right? You're going to have to be ready and willing to stand up for whatever it is you want. But you want to know the potential benefits and the risks. Okay. Now, I am not going into today all the risks that are out there. There are going to be some that I'm probably going to mention as we continue on about HRT, but this is really about the risks, the benefits and the risks of not taking it, because that would be, I'd be on here for another hour, right? And if you guys want that, you can find it all on Google, but I'm happy to do that for you if you would like. Okay. So what are some of, now we're going to talk two different things, short-term risks and long-term risks of not taking it. Okay. So short-term risks, hot flashes and night sweats. And yes, they can be awful symptoms. Are there ways to do it naturally? Without a doubt. Okay. And I'm not going to go into those today, but I'm just going to point stuff like that out. Number 2 is sleep disturbances. Without treatment, for some women, sleep disruptions due to hot flashes, night sweats can lead to fatigue, mood changes, and reduced cognitive function. Absolutely. Can all of that be handled naturally as well? Without a doubt. What's one thing missing that the HRT again might mask? If your reasons for your sleep issues are tied to high cortisol, which could then in turn lead to adrenal fatigue, that's not going to necessarily change that. Okay. Number 3, vaginal dryness and discomfort. Not using HRT during menopause can contribute to vaginal dryness, itching, and pain during intercourse. We're going to talk about ways to do that naturally a little bit. Because I'm going to take these next long-term risks and I'm going to debunk them for you. That's what I decided to do. Okay, mood swings and emotional changes. Again, these are short-term risks, supposedly. Hormonal fluctuations during menopause can impact mood stability and increase the risk of depression, anxiety, and irritability. And you know what that is all tied to as well? Your gut health. So you get your gut healthy, and usually you can fix a lot of those. So, okay, long-term risks. I'm going to go through them, and then I'm going to talk about each one. The biggest one they throw out there at you, they scare you, is osteoporosis. Okay, and we're going to talk about that. Number 2 is cardiovascular disease, heart disease, number 1 killer of women in this country. Number 3, urinary incontinence. Number 4, changes in cognitive function. And number 5 is loss of libidos. So those, were the most common ones that came up over and over and over again in all my research. So those are the ones I am going to address. Okay, so let's go up to Osteoporosis, bone loss. Menopause can significantly speed bone loss and increase the risk of osteoporosis. Okay. Research indicates that up to 20% of bone loss can happen during these stages, and approximately 1 in 10 women over the age of 60 are affected by osteoporosis. Okay. So 1 in 2 postmenopausal women will have osteoporosis. Most will suffer a fracture, broken bones, blah, blah, blah. So it's never too late to be treated for osteoporosis, and actually older women respond better, blah, blah, blah. Goal of treatment is to decrease fractures, right? So estrogen levels start to fluctuate and then drop. Since estrogen helps prevent bones from getting weaker by slowing the natural breakdown of bone, its reduction during menopause does speed up bone loss. Okay, it does. Everything I found says that. But you know what? There are ways that it doesn't. Exercise, resistance training, weight strength training, just getting your body moving can reduce the risk of osteoporosis. A balanced eating plan, foods that are rich in vitamin D and calcium and all that fun stuff. Exposure to vitamin D, being outside, right? Weight loss. Another reason that bone loss is higher is weight management. Preventing obesity will help keep, our bones strong. Smoking and alcohol can help reduce your risk of bone loss. So point being, HRT is not the only way to reduce your risk of osteoporosis. And are there women that are on HRT that still get it? Absolutely. Are there women that aren't on HRT and they get it? Absolutely. It goes both ways. I mean, it's not significant enough that any one study I found said that they will prescribe HRT specifically for osteoporosis. That's what I found. Okay. Number 2 is heart disease, right? Okay. The risk of cardiovascular disease goes up in our late 40s and early 50s, right? And it comes back down to, damn the E word, right? The fluctuation, the loss of the production of estrogen. Now, I want you to hear this part because this was really important to me. With the loss of estrogen, if you are not proactively handling your menopause or doing something through it, you start to accumulate more belly fat, right? Excess abdominal fat is the cluster of symptoms that does become more common after menopause. Then that leads to metabolic syndrome, which is when you have at least 3 of the following: abdominal obesity, high triglycerides, low good HDL cholesterol, high blood pressure, or high blood sugar, right? And when you have all these, the arteries become more vulnerable to disease, getting thicker and stiffer. And all of those things accelerate during menopause if you don't do anything about it. Now, if you're going to the doctor and you've been told you've got high cholesterol, high blood pressure, or high blood sugar, what do you want to do? Do you want to lower all those things or just go on HRT? This is my brain at work, right? Like, well, all right, let's figure out. Now, can cholesterol be higher due to the lack of estrogen? It can be. But does that mean that the HRT, looks like I've raised my hand on my own Zoom, is the only way? No. But metabolic syndrome is a thing, right? And we talked about insulin resistance in the other day, and these are all the same things, right? We don't want to mask these symptoms because we want to attack these symptoms so that we can take care of them now instead of in 20 years from now. Again, my thought on it. Okay. So, again, heart disease leading cause. Okay. Ready? Most effective way to prevent heart disease is not taking HRT, but it includes not smoking, being physically active, eating a healthy diet, maintaining a healthy weight, getting enough sleep, keeping cholesterol, blood pressure, and blood glucose levels under control. But as the American Heart Association would say, but very, very, very few people are good at following these. So let's take something that might mask a lot of these symptoms. Why would we want to do that? Okay. Increasing your physical activity. So now, and again, then I'm not going to go into all this. Recent studies says that HRT is protective for cardiovascular health if it is initiated within 10 years of menopause and the woman is healthy with no cardiovascular risk factors. Okay. So where did they talk about the factors? So low risk, recent menopause, normal weight, normal blood pressure, physically active, okay, and a less than 5% risk for breast cancer. That is what's considered a low risk person. Then intermediate, if you have diabetes, you smoke, you have hypertension, your obesity, sedentary lifestyle, limited mobility, autoimmune disease, metabolic syndrome, though you're considered an intermediate risk for taking this. Then there's a high risk if you have congenital heart disease, atherosclerotic cardiovascular disease risk, or coronary peripheral arterial disease, I can't even pronounce it, VTE, pulmonary embolism, stroke, blah, blah, blah. So again, this isn't the end all and be all cure, but right, for it to be like something that can be helpful, you're supposed to be sitting in that low risk, right? And you're already going to be healthy. Okay. So anyway. Yeah. Okay. Now let's talk about cognitive decline. So this came straight from the Alzheimer's Association. Okay. Can HRT help with mood swings? Yes. Are there other things that can help with mood swings? Absolutely. Okay. Phytoestrogen foods can help with mood swings. Getting your gut in better health can help with mood swings. Reducing your stress. Okay. HRT. So studies looking at whether replenishing estrogen levels using HRT can reduce women's risk of dementia have been inconclusive and contradictory. For example, some studies of women who were already using HRT during menopause found that their risk of dementia was lower than those not on HRT. However, other studies found no strong evidence for this. There is some evidence that HRT may even increase dementia risk. Clinical trials looking at the use of HRT to treat Alzheimer's disease in women rather than prevent it did not show any beneficial effects on cognition. Okay. Until there is evidence, the potential benefits this is from them. This is of HRT as a way to reduce the risk of Alzheimer's do not outweigh the potential risks of HRT, which can include cancer, blah, blah, blah. Okay. So next one. Urinary incontinence. That was one of the biggest things that said that was a long-term risk of not taking HRT. Okay. So urinary incontinence is incredibly common. One study looked at women between 35 and 55 and found that 30 to 40% said sometimes they leak. Yeah. Around 70% of postmenopausal women have an increased need to urinate and the urgency to do so. And perimenopause and menopause can exacerbate a problem that was already there. So why does it happen? Of course it happens because of the fluctuating hormones. The loss of the hormones, progesterone, estrogen, and testosterone cause the muscles which help support your bladder, known as your pelvic floor, and the muscles which close your urethra to lose strength. The loss of strength and tone diminishes the bladder's ability to securely carry urine. And at the same time, the loss of hormones can also affect the epithelium, which are the cells that form the top covering, making it a little more sensitive, thinner, less flexible, and less robust. Okay. This increased sensitivity can increase overactive bladder symptoms and bring on strong feelings of urgently needing to urinate. So it can. But so again, they say again, this Dr. Crockett says that often the symptoms can exacerbate a problem. A lot of women struggle with continence after pregnancy, and then when their estrogen levels start to decrease. So can you reverse urinary continence naturally? Yes. There are pelvic floor exercises. There are even like mesh things they put in there these days. You doing exercises, Kegels is one of them, right? Not carrying excess weight, watching your gut health, like treating things like constipation, cutting down on caffeine, alcohol, smoking, being careful when lifting heavy things, right? All of that can be done naturally as well. And so again, my point for this was I just wanted you to see if these are the top symptoms, these are the top reasons for going on HRT. I do want you to know and understand that there are other options. Okay, libido. So does HRT, has it been shown to increase that? Absolutely. But can it be done in a natural way? Yes. Guess what? It comes down to getting regular exercise, food, working on your anxiety, your mood swings, your depression, your gut health is all tied to that. Improving your intimate relationships, right? Low libido is a complex issue with it being psychological and physical components to it. More foreplay, lubricants, moisturizers, maca has been shown. I mean, there are a lot of like natural plants that can help with this. So that is what I just, want you to hear all that. Now, I want to just talk on something else. I looked it up right at the very end and I didn't have time to put it in my notes, but as far as the whole cardiovascular issues, phytoestrogens have also shown a potential to improve cardiovascular function and to decrease the risk of CVD associated through menopause. That is from the National Institute of Health. And here is the thing. Phytoestrogens can bind to beta receptors at lower concentrations than alpha estrogen receptors, so that phytoestrogens can bind to both receptors at the same time. This is what causes the protective effects of phytoestrogens on breast cancer and endometrial cancer. That's why phytoestrogens can be recommended even if you had cancer, right? So eating tofu, if you have had breast cancer, I mean, there are hormone-specific ones that are not recommended, but this is why increasing phytoestrogens in your daily diet, even if you've had types of cancer, is not going to have the same problem. In fact, Dr. Greger has done studies where it actually shows, because it does this conversely, it does both regulates it and adds to it. It can actually be preventative for breast cancer. So again, not getting in the place of your doctor, but that is one where you, if you are thinking you can't eat any of these flax seeds and these foods that have been shown to help with a lot of the vasomotor symptoms like hot flashes and night sweats, there's a lot of science out there that says you don't have to do it anyway. And so that was a lot. How long did I do? 34 minutes. Okay, I'm trying to keep them shorter. I did a little better today. So that's what I got for you today. If you are trying to make decisions, you're trying to figure things out, and you're not sure which way to go, I want you to have all the stuff you need, right? So yeah, there's a lot of information you can find on the internet. Again, recognizing that maybe your doctor might not know as much as you'd like. Maybe they will. It will really, really depend. If you want to see what the natural approach is, this reset I've got starting on Monday, it's exactly what it is, right? It will give you a little taste, a little teaser of what it would look like if you decided. Now, even if you are on HRT and you want to see what you can do to help balance things even further, please come join, because it's not going to derail the HRT that you're on. And again, let's be clear, one of the number one things, which I didn't even get into it here, though, that people want to change when you're going through perimenopause, or even if you're postmenopausal, is the damn weight gain. And HRT is not going to be that for you. That is not going to be, it's not what it's meant to do. So understanding that the rules of the game have changed now that you have hormones running the show, and that's going to be whether or not you're on HRT or you are not, because the delicate balance, the sensitivity that they have right now, and let me tell you, gosh, they want to overpower, and you have to be the one to take control. You got to be the manager of this team of your hormones, because if you're sitting there letting them run the show, you're not going to get the results you want. And that's not being pessimistic, and that's not just being Debbie Downer. That's just the way it is. You have got to be advocating to get everything in your body working together, because I don't know about you, this is how I felt when I was going through it. I mean, I was down at one point, you guys, to like 800 calories a day trying to lose weight, feeling awful. My body not releasing a pound of weight. My fatigue was through the roof. My sleep sucked because my body and my brain, nothing was working together. My hormones were such a mess, such a mess. And everything I was doing was adding to that. I was trying to over-exercise, underfeed myself. I was newly vegan back then too. So I was trying lots of processed foods back then too. And I was still drinking really heavily sugared coffees. I was like Starbucks at least once a day. Oh my God, I think back now. But those are the things I had to learn, right? So HRT is not just going to mean you have to no work, damn bubbly water, no work to do on your own. That's one small piece of the puzzle. And I feel like it's a little bit similar to this whole thing with the weight loss pills, or like everybody wanting a pill to fix things. None of that is going to work on its own. You still have to do the work. So do you want to do the work and not have the side effects, or do the work and get to know your body better and kind of really understand when things change, how to do it? Or do you want to take a pill, get the side effects, and do the work? I don't know. Or try to rely on the pill and then get frustrated when it still doesn't do what you want it to do, right? So these are all your own choices. I just want you to know all the ones that exist. That's my goal. That's my mission. Because instead of being told to sink or swim way back then, I wish somebody would have said, did you know, though, if you cleaned up, maybe if you stopped drinking so much wine, and if you stopped smoking and you cleaned up your food, you might feel better. I mean, I eventually figured out, but I had to do it all by myself. And I didn't like that. I really would have liked somebody to help me with that. And again, I do believe all of these things that our body is telling us right now, it's trying to set us up for success. Because you know what? If your gut health is messy now, and you don't address it, what do you think it's going to be like in 10 years? And do you want to deal with feeling that way for the next 10 years? Right? You know, if you've got a big sugar thingy going on, hi, Jackie, and you're not taking care of that now, what do you think it's going to do to your body in the next 10 years? Right? If you're eating a lot of foods that don't agree with you digestively, if you're getting bloated after your meals, where is that going to put you in 5 years, in 10 years? I want you to think about the big picture, you guys. I talked to one of my clients today, and we had a talk about like rewards and how this natural thing for us, right? Like we want instant results, and we want, I just lost 2 pounds, I should have some ice cream. We've become this kind of like, you know, this reward system thing. And I just want you to entertain the possibility that your biggest reward right now that you could focus on would be how you feel in 10 years or how you feel in 20 years. I know it's not sexy. I know it's not fun, but you know what? I want you walking around without a walker in 10 years, in 20 years, in 30 years, wherever you're at. I want that for me. And you've got the power. Now is the time. I mean, yeah, 20 years ago would have been even better. But now, if you haven't started, now is the time. And I will tell you, I'm going to jump off here because I know I see me and my talking. I was chatting with this woman in one of these menopause groups, and oh my God. And she's like, well, I eat terrible. How can anybody expect to feel good if they eat terrible? How? I don't know. I mean, and if you know you do, like, again, I talked yesterday, I don't know if you guys saw my post, but it's not about motivation, you guys. Don't think you're going to wake up and be motivated to exercise most days or eat healthy. If you're waiting for that, you're going to keep waiting. Like, your time to take action is now. So if you haven't gotten signed up yet, we start Monday. It's official. I'm not changing the dates. this is it. I had something that came up, actually, it was yesterday, that I could not change. So please come and do it. Get an idea of what it would be like to take control over what's happening in your body from an empowered place, from a place of understanding, from a place of really knowing your own body and what works for it and what doesn't work. And just feeling like you're in control of this whole experience. That's what I want. That's what I want for you. All right, you guys, if you have any questions, if you want to know where I got my research, please let me know. If you have questions about the upcoming Master Your Menopause Naturally, remember, this is the only time I only do it once a year, started last year. So this is the annual though. It starts Monday. So get yourself signed up, $25. Come on. 5 live trainings, 4 during the day, 1 at night, so that I can make sure I cover everybody. I mean, silly. Your body will thank you. Yes, Jackie's in it. So, because she is the queen of doing these, and I love it for her because we learn a lot by repetition. Yes, we do. All right, you guys, I will talk to you later. Bye.